Hi, my name is Adriana, and I'm going to be your nurse today. Today we are going to be doing a Foley insertion and removal. First thing I'm going to do is gather my supplies and shut the door for privacy. First I'm going to need your name and date of birth.
Anthony Saunders, 4493.
And are you allergic to betadine or latex?
No.
Okay. I'm just going to raise the bed to comfortable working height as well. So I gathered my supplies here. I'm just going to put a blanket over the patient to provide some privacy and an easy working area. Next I'm going to put on some clean gloves and provide perineal care. Just going to put this to the side. Okay, that's good. So next I'm going to open the catheter kit. I'm just going to remove the sterile gloves for the time being. Put those over here to the side. Next I'm going to place my sterile drapes onto the patient. So I'm just going to pick it up by the corner here. And I'm just going to place this directly underneath the patient. These would not be touching in real life. And then next I'm going to place another drape. That is going to go here. And then lastly, I am just going to place this drape just as an extra precaution, more sterile area. Okay, next I'm going to be putting on my sterile gloves. Okay. And then I'm going to prepare my area over here. I will not be using the hydrogen peroxide. I'm going to open the iodine and pour that over the cotton balls here. And then I'm going to also open the lubricant jelly, and I'm just going to put that directly onto this tray. And I'm also going to attach the syringe to the balloon port. I am just going to take off the cover here with making sure that this does not fly anywhere. And I'm just gonna put that directly in here. And to the balloon port, I'm just going to attach the syringe. Okay. So with my non-dominant hand, I'm going to hold the penis, and with my dominant hand, I'm going to use every cotton ball and go around in a circular motion. Making sure I don't overlap and making sure I hit every area using all 5 cotton balls. And lastly, I'm just going to do one swipe through the middle. Okay, and then next, I am going to, thank you, I'm going to make sure I wind up the Foley into my hand so it doesn't go anywhere, and I'm just going to dip that into the lubricant. And I'm going to move the box closer to the patient as well. And I'm going to ask the patient to bear down and slowly insert the catheter until I get urine return, and then I'm going to advance it 1 to 2 more inches. Okay, and then with my sterile hand, I'm going to go ahead and grab the syringe, and to hold it in place with my dirty hand, I'm just going to hold my hand right here to make sure that the catheter doesn't move. And I'm going to inflate the balloon and then gently pull on the catheter just to make sure it's in place. I'm going to remove that. And then next I'm going to, with a piece of tape, secure the catheter to the patient's leg. So I'm just going to lift this up if this were the patient's leg, and I'm just going to tape it directly on there. And then I'm going to make sure that the bag is below the patient, and it is on a spot on the bed that's not movable. And then I'm going to just remove all of my drapes. And then I am going to just make sure to clean and dry the area before I leave. I'm going to dispose of all my supplies. And then I'm just going to make sure that the patient is in a comfortable sitting position with the rails up and the call light in reach. And then I'll take my gloves off and provide hand hygiene.